How we care for sick children has gone through a complete and total revolution. And it's a story that's about way more than just medicine. It's about a massive shift in how we see childhood itself. So in this explainer, we're going to break down that transformation.
You know, it used to be pretty simple, right? If a child wasn't actively sick, they were considered healthy. But that's just not how we see it anymore. Today, the World Health Organization's definition is so much broader. A state of complete physical, mental, and social well-being. We're not just fighting off germs anymore. We're focused on nurturing the entire child.
To really get a grip on this shift, we'll take a journey through a century of change. We'll look at the new philosophy that's guiding care, and then we'll tackle the biggest challenges that we're still facing today.
Okay, so let's start by winding the clock way back. Because to truly appreciate where we are today, we really have to see just how different the world was for children a century ago.
I mean, just try to picture it. Crowded cities, poor sanitation, no vaccines, and these deadly epidemics just sweeping through neighborhoods. In that world, child labor was normal, and children, well, they weren't just seen as children. They were often viewed as part of the workforce, and their individual needs for protection and care were pretty secondary.
But then, the tide really started to turn. A whole series of landmark laws began to build a safety net. It kicked off in 1912 with the U.S. Children's Bureau, the first government agency of its kind in the world, by the way. And that was followed by these total game changers like Social Security, Medicaid, and CHIP, each one systematically tearing down the barriers to a healthy childhood. And wow, the impact was just undeniable. Just look at this chart. That steep, steady decline in infant and newborn deaths isn't just some line on a graph. It's the direct result of all these public health efforts and a new societal promise to protect our most vulnerable. It's lives saved.
So as survival rates got dramatically better, the goalposts shifted. It wasn't enough anymore for children to just survive. The question became, are they actually thriving? And answering that required totally new ways of measuring health.
Frameworks like Healthy People 2020 give us a kind of blueprint. And think of it like this. It's not just about measuring the length of a child's life, but the breadth of it. It forces us to look at everything, from their quality of life and environment to the really stubborn disparities that mean a child's health can still be determined by their zip code.
Now, this slide is really interesting because it basically tells the story of a child's life through data. For the little kids, ages 1 to 4, it's respiratory illnesses that are the top reason for hospitalization. But then look at the 15 to 19 age group. All of a sudden, mental health disorders become a primary cause. It just highlights how dramatically health challenges evolve as a child grows up.
This new, broader understanding of child health absolutely demanded a new philosophy of care. It led to a fundamental change in the very DNA of pediatric nursing, and it's all built on 3 core pillars.
So modern pediatric nursing, it really stands on 3 pillars that have completely changed the game for sick kids and their families. You've got family-centered care, traumatic care, and evidence-based practice.
The first one, family-centered care, is a total game changer. It moves way beyond that old model where parents were basically just passive bystanders. Instead, it recognizes that the family is the child's greatest source of strength, and that makes them an essential, active partner in every single decision.
The second pillar, atraumatic care, is all about one thing: minimizing distress. This means using every tool you've got, from pain reduction techniques to just explaining things in an age-appropriate way, to make sure a hospital visit doesn't become a lasting trauma for a child or for their family.
And that third pillar, evidence-based practice, well, it makes sure care is both smart and effective. It completely replaces the old, "this is just how we've always done it" mentality with a simple principle. Every decision should be backed by the best scientific research available, the clinician's expertise, and the family's own values.
So you take this new philosophy, and it completely transforms the role of the pediatric nurse. They are not just caregivers anymore. They are advocates, they're educators, and they're coordinators. They're really the critical hub in a child's healthcare journey.
I mean, today's pediatric nurse wears so many hats, as you can see right here. They're a powerful advocate, an essential educator, and a skilled case manager. But really, above all those roles, they are that central, trusted figure for the family that's navigating a really difficult time.
Now, with all these expanded responsibilities, you absolutely need a strong ethical and legal framework. And these principles aren't just, nice guidelines. They are the non-negotiable foundation of modern pediatric care.
This quote really gets to the heart of it. Respecting the family's central role isn't just a nice idea,
It is clinically proven to lead to better health outcomes and, honestly, a much more positive experience for everybody involved.
Informed consent is one of the most critical safeguards in all of medicine. And while the physician is the one who explains the treatment, the nurse often plays this vital role of translator and advocate. They are there to witness the signature, yes, but more importantly, they are there to make sure the family genuinely understands what they are agreeing to. They're that crucial last line of defense.
But for all of this incredible progress, the work is far from over. I mean, significant challenges in child health remain, and new ones are always emerging.
A huge barrier remains: poverty. This number, 20.7%, that's more than 1/5 of all children in the U.S., and living in poverty directly impacts everything from nutrition to access to a doctor. It just creates this vicious cycle of poor health.
And right alongside the challenge of poverty, we are facing a growing crisis in mental health. 1 in 5 children, that is a staggering number, has a mental health-related problem. And if that's left unaddressed, it can cast a shadow over their entire development, their education, their whole future.
And all of this leads us to one final vital question. Challenges like poverty and mental health are just too big for nurses and doctors to solve on their own. It forces all of us to ask, what is our collective role in making sure every single child has the chance to have not just a long life, but a truly healthy one?